So, hey guys, welcome back to PW Media YouTube channel. Once again, I have with me Dr. Pragya Mitra, and she's got a rank of 248. I think more than the rank, the journey and something which is not traditional, which she has cracked, and that's what makes this interview very interesting. We're going to get insights from her. She's been with us for the past 3 years, and she's going to give us more insights on how to do the unconventional way and still get a very successful rank of 248. For beginners to just to have a hook in the interview that she's read for 2 months, I can say so, right? Hardcore preparation for NEET PG for 2 months, but still she's able to was and did crack very highly competitive exam of 2.5 lakh people and came to 48 in that, right? Hello, Pragya. How are you feeling?
So I'm feeling good. Hello.
Great. So, Pragya, can you give the introduction about an audience about just about you, like which college are you from? What was your passion during medicine? Did medicine was really your passion, or parents forced you, or you got a mark so you got it? So, what's about you? What's special about Pragya?
So I am Dr. Pragya Mitra and I'm from University College of Medical Sciences, which is in Delhi. I My entire schooling was actually done from Bangalore, and since I think middle school, I was inclined towards medicine because my father had a heart attack and stroke when I was in seventh grade, and after that, I was a little bit inclined towards medicine. In my 11th and 12th, I was slightly deviating towards engineering because I did not want to leave maths and physics. But by then, I'd already gone through a lot of journey for my medical entrance. So I thought, okay, when medicine is finalized, let's just proceed with it and we'll see what happens. So after I joined MBBS, I was happy only with taking medicine. I did miss a little bit of maths and physics, and even now I kind of miss. So I do try catching up on my basic maths and physics. And even now after NEET, I was revising a few topics. Like I was reading a little bit of physics here and there. Like that's just my passion that's there. Like I'm not someone who can do one thing at a time. I also love painting portraits, and I am a writer as well. So I try to dive into new topics, new niches, and find like new interests. Like I can't stick to one thing at a time. So yeah, that's about me.
So it's multi-talented. The background is also by you. It's an amazing voice
Uh,
over there.
no, this is not by me.
Perfect, great. So, Pragya, you said you are from UCM, right?
Yes,
So,
sir.
how was your entire journey of 4 years of MBBS? Because most of the students say that I have to start preparing for NEET PG from the third year onwards for me to get an decent rank, a good rank, or an whatever rank which gives them the college of their choice. Were you someone who started to focus on an entrance prep from third year, or you just enjoyed learning medicine as such, as per your the college curriculum recommends?
Sir, honestly, initially first and second year, I did have a NEET PG in my mind, but I was not preparing for the entrance exam. I was always academically focused, and I used to prepare according to the curriculum, and I solved MCQs from question banks here and there. But I was mostly focused on my curriculum and my profs and clinical postings as and how it went. From third year, actually, my focus shift to writing PLAB.
Okay.
So I was not focused on NEET PG entrance exam because I started going to clinical postings. I saw how was it in India, and I did not want to do my PG from India initially. So I wanted to move abroad. I evaluated different countries, and I settled upon UK because that time UK was a very good option for emigrating abroad. So from then I started focusing on PLAB. But again, I didn't have entrance exams in mind. Till final year, I was focused mainly on getting my concepts clear, attending clinics regularly, and I did not take that much stress or studies as such. Because for professional exams, even if you study a few months in advance just for the exam, you can easily clear the exam. I wanted to get my clinical knowledge cleared during the rest of the year. So that was my main focus. And during my internship, I started focusing upon PLAB because it's relatively an easy exam since it's a qualifying exam. You do not have a competitive background there. You just need to pass. Like there is a qualifying mark, and if you get above that, you are eligible to go on to the next step. And it is a very clinical oriented exam, but the syllabus is relatively very short if you compare it to NEET. The questions are much more clinical oriented and lengthier, I would say. But again, the syllabus is short, so preparation is very easy. So my entire internship, I was focused on PLAB 1 because before that we need to give an English exam, IELTS, to show our English proficiency. And after that, I was focused on PLAB 1. And even till the completion of internship, till my graduation ceremony, I was focused on further clearing PLAB 2. I had booked my PLAB 2 for 9th November. And I had also got my UK visa. But then suddenly in June, sorry. Suddenly in June, I realized this thing was there in my mind since the last year that UK has been reforming its laws, especially the NHS, the National Health System. That's actually the government setup in UK that governs doctors and the appointment of doctors in the government setup. So they have been reforming their laws a lot, and especially for international medical graduates, it's becoming tougher and tougher to get into UK. They are preferring their own internal medical graduates over the international medical graduates, as should be the case. But during COVID-19 times, it had become totally reverse, and they were accepting international medical graduates a lot. So that time, it was a great option to shift to the UK, and especially the work-life balance is much, much, much better there. UK and Australia, these are the two places where the work-life balance is really good. And for me, since I'm involved in so many things, I wanted the work-life balance a lot. I am not someone who can dedicate my whole life towards medicine. Like I've heard so many of my very great professors say, like especially surgery and medicine professors, that you need to dedicate yourself towards this. Only then you can become a good doctor. But I am someone who cannot do that. So I needed a good work-life balance. So that was my whole plan. Even for 1 year, all these reforms were going on in the NHS. Even till then, like till June, I wanted to persist. I mean, kept on feeling that it is difficult, but it is not impossible. One or two people would be getting. But then I just saw the ratios and the chances, and it was pretty I felt it was not useless, but till then I had not given as much commitment. Like once I gave PLAB to, once I shifted to the UK for 2, 3 months, I would give a much more financial commitment towards my UK journey. And I felt instead of putting so much investment on something that's not that certain, I just felt it was not intelligent enough. So in June, I cancelled my lab two, and I decided that I'll focus on Indian PG. And at that time, NEET 2025 was in June. So I had no hope for that. I just filled the form, and my main focus was November INI-CT. But luckily, and I also joined GR because in anyway I was not going to get I was not going to clear the NEET in June. So I thought I'll take JRship, and because I cannot sit in my house and keep studying all the time. And JRship in my college is like very limited to 48 hours a week. So I felt I can balance the work and studies. Like I had 6 months time, so I thought I could do it. And anyway, we have ad hoc period appointments for 44 days. So after that, I can resign. And if I'm not able to go, I'll just resign and I can continue with my studies. But thankfully, after I joined, after like 3 days of joining, they postponed NEET and I got some time to study.
Got it. So I think, Pragya, I think it's safe to say that UK policies didn't let our country lose a bright mind. I think we will do forever, and hopefully you will get to do all the things what you want to do. See, one thing, and again, I want to ask you is like, you said that you are not able to concentrate on anything or sit and read for a longer time, right?
Yes,
But
sir.
at the same time, you are a very bright student. You have been
Yes, sir.
getting distinction and honors, and you've cracked this exam at 240 with the 2 months of preparation. Uh, MCQ solving is not something which easily comes to a person. So you
Yes, sir.
need practice, right? Be it in PLAB or be it a USMLE or be it a NEET PG, you need practice. So when you are focusing purely on your professional exams, your clinics, you are good at that. You work during an internship hard, but still, what made you, or did you do anything extra, like which made you get tuned into solving the? Because art of solving MCQ is totally different. Did you do anything extra so that when you read the question, you can see sense, okay, this could be the right answer. So did you do anything for that?
Um, so if I tell about the period just before the exam, one thing I knew, like even if I had, like for serious preparation, I had around 3 weeks. So even during that time, I knew that I need to practice questions more than studying. Like obviously studying is a huge part, but practicing questions is equally important because like I had always heard my seniors say that my seniors and mentors always used to tell that you need to start giving the GTs as soon as possible, even if you have not completed your preparation. Like if you have 1 year, you start giving from the first month itself. Give one GT a month, then after 6 months, move it to two GTs. But I didn't have that much time. So in these 3 weeks, along with preparations, I gave around five GTs, and I did see an improvement in the score. So, number one, I felt giving GTs was important, not only to get a hang of the MCQs, but also to know time management and more importantly, temperament management during the exam situation. But if I just talk about the MCQ aspect, I did not have time to solve too many MCQs, but I used to try to solve around 40 to 50 MCQs a day, like whatever topic I've read, I used to solve. I didn't solve random MCQs because I didn't have as much time. Just solved the past year questions from that particular topic so that I get to know what type of questions are being asked. And even I myself noticed a gradual trend in the questions. Like initially, it was very factual, like one or two liner, and gradually I've seen in the recent years that, as people say, that it has become more and more clinical oriented. But apart from this, this was just for like the 2 to 3 weeks before the exam. I practiced a few MCQs. But even initially, I did have a little idea about how to rule out options and what option the examiner might be favoring in this question. It was a kind of intuition that I got. I didn't practice a lot for that. I think this also, sorry, like this also was there during my UG days. Like when I was preparing for NEET UG, that time I had practiced a lot. So I think a little bit of that remained in me and I was able to solve. And also I was a very active member of the quizzing society, medical quizzing society in my college. And I used to love making questions and also solving questions made by other. But I think making questions part made me a little bit more intuitive about what people who make questions might want to ask. So I think that helped. But I don't have a definitive answer because I'm not someone who has practiced a lot like many people.
So I think the one thing which you said last, like, thinking in terms of an examiner, that's like
Yeah.
you make questions. Like so you know, like okay, I have to structure this so that I can create a bait where most of them might fall. So I
Yes.
think that might have helped you a lot. And young audience should start making questions as equal, maybe a bit earlier whenever they get time, or maybe.
Sir, one more thing I wanted to add, like that I just, this thing came into my mind, is that when I was reading the questions in the exam, number one, I was very mm, cool down. Like I was not actively thinking it's the exam center. And when I was reading in the clinical scenarios, okay, like there's a 68-year-old lady, I'm imagining a lady who has come to me with so and so symptoms. I'm like thinking as though it has actually happened in the OPD or in the emergency. I'm trying to visualize it. And that's why I felt that I didn't have to read the question and again, like some people have to do, because I had visually imagined the whole scenario taking place in front of me, and I could answer the question just after one reading, which did not take a lot of time. So I think even this helped a little bit.
Perfect. So it's more like the exam center also made felt like an OPD, and you're like a functioning real doctor in life. And that's a good advice that future aspirants can take from her. Like, make sure that you kind of have an imaginative thing that'll help you kind of tide over the 3 years, which is very, very didactic and which is very kind of stressful as well, right? So, Pragya, like, what do you want to tell to your juniors? Like, is concept building in the first, second, third year more important, or they should be more focused in solving MCQs if they have to crack the NEET PG in the first school?
So I would say concept building is more important. Of like after reading a topic, yes, you can solve a few questions just to test yourself. But again, I would stress more on concept building. Questions and solving questions can come in the final year or internship part also. And once you start solving questions, it doesn't take that long to get the hang of the MCQs and the patterns, the repetitive patterns that keep coming. It doesn't take 3 or 4 years of practice. Even hardly a few months can do that. Like especially if someone has all the concepts cleared by final year, they can easily focus on question solving, past year questions, even in the internship phase. Or if someone has time before, like when they're studying that subject, they can solve past year questions. But again, I would say concept clearing is very important, especially in this time's need. Even while writing the paper, I felt it was much more conceptual than rote learning based. I think I could point out hardly three or four that were just rote learning based. Mostly it was conceptual and from residual knowledge.
Okay. So Pragya, you when we were discussing before, you said that you scored distinction honors in quite a few subjects across the years, and also you said
Yes,
that you are a person who reads on a average basis just for acquiring knowledge, but in the last few months last few couple of months before prof you will put more effort, right? So we have
yes.
to discuss for it, like what is your guidance to your juniors, like how they can utilize the last 6 months, because getting a distinction at the first year is the first stepping stone for success. So when I do something, I can get something out of it. So how a junior can use.
So I feel that number one, conceptual learning is very important. So most of the year they can spend behind conceptual learning and reading the topics and getting to know the actual subject matter. What is helpful in getting the distinction is actually how you present the paper, how you write the paper. Like even the answers, if you write as a paragraph, you will not score as much as if you write in a flow chart or table. So presenting the paper itself is an art. Like you, apart from writing clearly and neatly, like that is very rudimentary. Nowadays, that is not even a concern for medical students. What is important is you highlight the keywords, you highlight the concepts in the form of flowcharts. So these are certain skills that needs to be picked up gradually. And we had semesters and assessments in our college in between the main exams. And initially in first year, for the first semester and even the subject, the like the class tests that were held, I used to try to incorporate all these things. My seniors had told me try to highlight using a black pen or basically show the examiner that you know. Even a person who does not know in medical professional exam, they just keep on writing paragraphs. So in general, if you're writing a paragraph, most examiners I feel tend to think that you're just making stories. So basically, if you want to get more marks, you need to show the examiner that you know. So this is one very important point that needs to be picked up as a skill when you're trying to like write professional exams. But apart from that, there are certain volatile things that need to be revised also. So for that, I think Furry is a very good option for, especially for last minute revision. Like it's a very concise way in which the questions that are most important for professional exams only they have been listed, and in a very concise manner it can be revised very fast. So I would say Pare is definitely not the initial go-to for any medical student. They should first build their concepts from longer notes and textbooks or lecture videos, and after that for revision and for solely preparing for professional exams they can move on to Pare. And probably they can also make their own notes, so that I feel own notes is better. Just that one day before the exam is the own notes that help. So, in my opinion, either they can edit the foray or they can make their own notes from that. I think that would help.
I think we're coming back to the same point again. Like it's the conceptual learning from the books. Maybe live lectures will help you to solve any queries instantaneously from the teacher. Foray is like the last minute push because everyone needs
Yeah.
that extra drive. Because when you have anat, physio, biochem, pharm, patho, micro, or nowadays 6 or 9 subjects in the final year, you need some push for that. And also, like you said, to how to template an answer, because templating
Hmm.
and presenting is more important than the colors and the handwriting these days. So that's what Pare might help you. And once that push is there, that push in the first year will automatically go to the internship, and the drive to win also will start coming, right? So now let's say that there is an trend. Some of the students tend to skip clinical postings and more go into books. So, what's your opinion with that? Like, is clinical postings really helpful in solving the questions? Should they start, because NMC forces them to have a very early clinical exposure, right from first year they have been given visits, and second year they have a very intense curriculum to do that. So, should a student follow it, and is it useful? Because I know it's useful, but from your point of view, is it useful for a NEET PG exam? Because that's what will make them help it. Is it useful from a NEET PG exam?
Sir, I think at the onset only I would say it is very useful because just as I told, in most of the clinical questions, I was imagining the scenario, how it would take place in front of me. but that was because only I attended a lot of clinical postings. I used to regularly go to clinical postings. Even my internship, I performed very diligently compared to most people. Like even my seniors who were monitoring my internship, even they told that I was quite diligent. Obviously, did not. Obviously, the result was I did not have as much time for my studies. But again, I was lucky. I was just preparing for PLAB, so I was able to balance it out a little bit. And even after that, I did my GRship for about 2 months. So I had quite a lot of clinical exposure, and I think it really helped me in the exam because I felt from a NEET PG point of view that they are now trying to test what a junior doctor experiences from a day-to-day basis. Like initially, I feel a few questions are also focused on super specialties, like what a surgical classification of this or that, like what I feel a junior doctor should not know. But again, in this paper, I felt it was focused on more what a junior doctor should be knowing. So, which, and I think I got a lot, my clinical exposure did help me a lot. And apart from that, if I feel that if someone is just focusing on the books, there's a tendency that the person will get bored over a period of time. You need to see the practical application to understand why is it important. So I think attending clinics is definitely important.
See, coming to the point, like there are n number of colleges in the country, and you are blessed to be in one of the topmost colleges in the country. Some places where you don't have a proper guidance, or let's assume that it's a first batch of the college where I don't have an exact senior to guide. So we have a product called Clinical Corner. How can a student use Clinical Corner as a guiding source? Because not every person is okay to go and ask a doubt to the junior senior. They'll think that what will they think if I ask a very basic doubt. In that instance, for a person who's like an introverted person or a person who's not having an exact guidance, how can they use Clinical Corner to upskill their skills so that whatever they read can be applied in the real life? That's also a sort of revision. So how can they do that?
So I personally feel that the clinical corner is framed in such a way that the case history and examination pointers are given. So in my case, I felt that it was helpful if I suppose I know that like we used to get schedules that so and so dates you need to take a case history of so and so, suppose alcoholic liver disease or hemiplegia. So I knew that I will have to take a CNS case tomorrow, or I will have to take an abdominal case tomorrow. So I used to obviously study the theory a little bit the previous day and also go through the case performer that is there in clinical corner one day before. And apart from that, I feel like the next day, the day you're actually supposed to take the case, it's not easy to recollect everything you've just studied one day before, especially in front of a patient. You do get performance anxiety because that time we are just new doctors who have come and the patients are just staring at you. They're expecting you to tell something substantial. And most of the time they're asking you about the case, that whether they are going to recover. And it is just very overloading. So if you're trying to recollect what you read in your textbook and then trying to ask your history, negative history, and what all to rule out, it takes a lot of time and you tend to miss out on very important differentials. So I feel in that case, a clinical corner, since it's just a performer type of, it's just a template. It's a very handy bedside tool. You can even while you're taking question, your friend can actually go through and just check if whether you've asked everything, or you can use it as a template. Since what I have seen, it's the most of the questions are single liners. It's very easy to see and ask also. So even if you're not prepared that much, because most of the times we might not even get time to prepare for that case beforehand, you might be suddenly asked to take a case of a particular patient. So then you can, I think it is helpful if you just open the template and at least ask the relevant questions. At that point, again, people might not know its relevance, but then it is easier to go back and check why did I ask this negative history? What exactly am I trying to rule out? Rather than just, if a student goes and asks the case history without knowing anything, most likely that student is wasting his time and the patient's time. So if there is a template at hand, it becomes much easier.
Perfect. So, like, how was your internship, Pragya? Like, you said you were your seniors said you were diligent and you also worked well. So, there, if you look at NEET PG paper or any competitive exam for that matter, there will be a subset of questions which comes from a practical experience, like an emergency situation, how to handle. Suddenly, a road traffic accident patient comes. You need not always memorize that, okay, normal saline should be given, okay, ringer lactate should be given. But there are some things which comes to a doctor on an own. Like, that's a
Yes.
different. Like, so how does an internship help you in deciding those questions?
So I think just as you told that it just comes as a natural instinct. Even this paper, I felt many questions were just coming as a natural instinct. Especially I did my JRship, which is kind of similar to internship only. And JRship is like an extension of internship. So I did my JRship in Obs Gynae for 2 months, and there were a lot of questions from Obs Gynae, and most of them I did not have to actively recollect because they were showing photos of maneuvers being performed. They were just asking more practical thing that in breech delivery what all steps in what all order, and I had actually seen breech deliveries taking place, so I think it just came naturally. Honestly, I did not have time to go through the huge gynae syllabus also that was there. Again, I went through very selective things, just the malignancies and things that I tend to forget. So most of the things, I think that's how it was answered. That's how I was able to answer because I had not read this subject matter. The last time I read it, it was in final year. But since I've seen it being performed multiple times in internship and after that my JRship, I think it just was there on my fingertips. I didn't even think about it actively.
Great. You said like you had almost like maybe a couple of months to kind of shift gears from PLAB to NEET PG. And you also said that there were a few volatile topics which I went through. Like, for example, you said in PATH, I just brushed up on tumor markers. Like, was PW Medic's vitals helpful in that? Because we have a section for most of the volatile things, which it's not about forgetting, they are too intensive to remember.
Yes,
So,
sir.
did that help, and was it a good tool for you for while you are at internship or a JRship to just quickly go through it?
Yes, I think it is actually an excellent tool, especially sometimes when you're just sitting around, you don't have any particular thing to study. You can just open a vital and just go through it. Because these are not something which you can keep on repeating in your head and learn. I think it is something that you see over and over again and then learn. So for me, vitals, I did use it in this way. I revise these volatile things much more than the other portions of the syllabus. I revised around 3 to 4 times since I was short on time. And after that, I also made my own vital list, if you can call it, which I will revise one day before the exam. I always had one day, like during my preparation, I have this in mind what I'll do one day before and 3 days before the exam, because that I feel is most crucial. So during practice only, I felt that this is something I'm going to forget. Let me note this down somewhere else. Uh, like even for the volatile things, some things might be more volatile for me than other people, or vice versa. So what is most volatile for me, I used to note that down.
Perfect. So
That way.
I think I can fairly say that it's not a 2 month preparation. It's a 5.5 year plus 2 month of preparation. That would be an aptly put thing rather than saying that you did it in 2 months. So great, Pragya. Like you also emphasize the importance of giving GTs. Like your seniors told, give GTs, and since your focus was more on PLAB, I'm sure you must have given practice exams for PLAB, right?
Yeah.
So Meded has a GT predictor tool, as well as they had quite a few GTs focused on the NEET PG exam. So how was those GTs helpful? Did you give any GTs in the last 2 months? And if you can reveal the score, what you got to the students?
Yes, so like initially, I think when I decided to skip from change from PLAB to NEET, that day itself I had given a GT. Like, let me see at ground zero, what is my level? Obviously, I knew that I have some knowledge. I have studied throughout my MBBS. I will not get zero. Like, I will at least get 50% of the marks. And that was what happened. I don't remember the score. I remember the number of correct answers. So I think in my first GT, I got like 122, like without any 122 and 200, without any preparation, like solely for NEET PG. Like this I had got from whatever was my residual knowledge. So after that, I used to write. This was in June when I had initially thought of switching. So and then I had my GRship also going on. So I used to try to write around one GT a week. That
Mhm.
time I could not prepare as seriously for NEET as is expected. I used to read around 2 chapters a day and solve it a little bit of MCQs. So during that phase, I used to try to give one GT a week minimum. And then after I quit my GRship, that is in mid-July. After that, I started serious preparation. And from that time, I used to try to give a GT every 3 or 4 days.
Hmm.
So, especially, I could see the trend, the increasing trend, but I would actually not say it was not as slow. Sometimes it used to increase, and then the next GT it used to again decrease, and again it used to be disheartening. I'm thinking I did prepare for the last 3 days. I improved myself from the previous GT. Then why has my score gone down? But again, the distribution of questions is very different. Again, if a different NEET paper would come, I might not have got this rank. I might have got a much higher rank. So it is very different. So I think you should not solely judge yourself on the GT, but again, it is important because it gives you a little bit realistic idea upon where you come, and especially since it is a competitive exam, you need to grade yourself with respect to others as well. And also, apart from everything, it gives you that time management skill and how you're maintaining your temperament, how you're keeping your temperament under control. Because writing a 3.5 hour paper, I initially, when I wrote that first GT, I was totally drained.
Yeah, true.
So, yeah, I think that's how it helped me.
Okay. Pragya, if it's okay, like a few rapid questions, like answer in maybe a word or a line without thinking much,
Okay.
right? Medical
Okay.
branch or surgical branch?
Surgical.
Surgical branch, great. So, what makes you get into medicine or stay long for reading? Is it the clinical corner type of content or a vital type of content?
Clinical corner.
Okay. So, which is easy to solve, a scenario-based question or a one-liner?
Scenario based question.
Okay, great. Which is difficult, an image-based question in pathology or a radiology?
So, image based or
Difficult. IBQs in pathology, histology, basic sciences, or radiology or clinical medicine?
which is difficult. I think the basic sciences one.
Okay, which is more important for an undergraduate to emphasis more on to score an amazing rank, the basics or the third and fourth year? Like if I can divide into preclinical and
So
clinical.
basics, without any doubt, basics.
Okay, so which is good to revise, to read again, the textbooks or the notes?
Notes.
Notes. Okay, great. Perfect. You covered most of the things. And is there anything which you want to tell to your juniors at UCMS and juniors across the country, like someone who is starting their medical journey, because many of them will be looking up for you, or someone who is completed maybe in the middle, like second year, or someone who's in the internship or post internship? We can divide into three. Let's keep it short. What is the advice you want to give it to a person who's entering medicine? What they have to do, not again, not just to score a NEET exam, to become an amazing doctor, which is the ultimate goal.
So a person who's just entering, I would say that they have already solved a huge entrance exam and they're coming. And I would not want them to even think about NEET PG now.
Hmm.
Because you never know. You need not even give NEET PG. You can go into other things as well. So at now they should just focus on learning what they have already worked so hard for. And they should focus on the basics, the especially the pre and paraclinical subjects which form the base of everything. And again, as again since nowadays the clinical exposure is also increasing, they should also devote themselves towards it.
Perfect. So, a person who's completed their second prof and going into the clinics, what should they do? What's your advice?
Sir, again, I think it would be a similar advice because even after second prof, I think is a little early. You need to keep your concepts clear, both the pre and paraclinical, and especially now since they're starting clinical, I would say not to keep the syllabus lagging behind. Solve, like try finishing the syllabus as and how it's going, either in your college or if you're following someone's lectures. Just try to go with the flow. Do not keep a syllabus lag behind. Again, I would say do not try to step on both the boats. Don't try to go along with your college as well and then prepare some other, try to follow someone else's schedule as well. Stick to one schedule, but try to keep solving, try to keep covering the topics as and how it goes. Don't keep a huge chunk lagging behind to be covered before exam.
Great. So, for a person who's post intern, completed the internship and is going to give the INACT exam, are you going to give the INACT exam?
Yes, sir, I'm thinking I'll do.
So, maybe to your fellow colleagues and who will be competing with you, what is the word of just something you have to say, like for a post intern, this worked for me and that could work for you as well?
So I think INI-CET does focus a lot upon the recent updates part as compared to NEET PG. NEET PG, I did not get as many questions on recent updates. So I think that is one section in which it needs more focus while preparing for INI. And again, I would say give INI focused GTs because the pattern of questions is a little different. The focus of questions is a little different, the topics that they're focusing on. And another thing, which I think is very common for during preparation of INI CET is the past year questions. It is well known that INI questions are repeated again and again. Sometimes the whole question is just repeated. So I would say past year questions is very important.
Great. Thanks a lot. Thanks a lot for your time, Pragya. You've taken good enough of your time, and all the best wishes for the INICT. And I hope even in future we don't want to lose you to London. So stay back in India, and hope we serve better, more people in India, and hope our country's work-life balance might be in future better than UK as well. Right?
Thank you, sir.
Thanks a lot. Thank you. Shiv, Shiv, can we end recording? Oh, I think Pragya, we can leave. It'll automatically end the recording. Thank you. Thanks a
Thank
lot.
you,
All
sir.